In this podcast episode, Joe Rogan engages in an extensive conversation with Robert F. Kennedy Jr., covering a vast array of critical health, policy, and social issues. Topics range from healthcare fraud, chronic disease, and food policy to the intricacies of immigration enforcement, the role of psychedelics in mental health treatment, and concerns about free speech and social media. Throughout the dialogue, Kennedy offers insights into systemic problems, economic incentives in healthcare, the importance of bipartisan cooperation, and emerging solutions involving technology and regulatory reforms. Kennedy begins by explaining the massive dysfunction within the U.S. healthcare system, emphasizing its focus on sick care rather than true healthcare or disease prevention. The system's excessive costs, spending trillions annually, more than any other nation, while having the highest chronic disease burden, stem from deeply entrenched perverse incentives that reward volume over health outcomes. He highlights rampant fraud, especially in Medicaid and Medicare, with annual losses estimated at $100 billion. Organized crime networks, including foreign actors such as Cuban and Russian groups, exploit loopholes by fabricating patient identities and billing for fictitious durable medical equipment or hospice care. The delegation of oversight was severely weakened during the Biden administration when the Program Integrity Office was reduced in both size and scope, shifting focus solely to enrollments rather than fraud prevention. This allowed widespread abuse of home and community care waivers, where family members could be reimbursed for services not usually billable, like grocery shopping or driving relatives. Minnesota exemplified this trend, with autism care costs ballooning from an anticipated $3 million annually to $400 million, mostly fraudulent claims. Kennedy lambasts the political partisanship fueling denial and inadequate responses to these issues, and stresses the urgent need for program integrity enforcement and bipartisan cooperation. Early in the discussion, Kennedy touches on the personal strategies he uses for focus, including noise-canceling headphones to block distractions, which he aligns with managing his own ADHD. This segues into a broader reflection on modern podcast culture, with Joe Rogan acknowledging how long-form one-on-one conversations model civil discourse, helping break ideological barriers through curiosity and sustained engagement. Kennedy praises this format, noting its role in fostering understanding amid extreme polarization amplified by social media algorithms designed to outrage and divide. Kennedy offers a candid assessment of U.S. political realignment over recent decades, explaining how traditional party platforms have evolved or inverted. He describes his own political journey from lifelong Democrat to an independent forced to abstain from voting after residency legal challenges. He criticizes both parties for ideological obsession, especially the Democratic Party's opposition to anything linked to Donald Trump, which, in his view, undermines public health and honest debate. He calls for de-escalation of partisan conflicts by appealing to common sense on issues like healthcare fraud and child health, urging recognition of bipartisan priorities such as transparency and prevention. A significant portion of the conversation centers on food policy reforms. Kennedy recounts inheriting a compromised, lobbyist-influenced dietary guideline system that promoted ultra-processed foods while sidelining nutrient-dense natural options like whole milk. Under his tenure, new dietary guidelines were developed by top nutritionists, aiming to reverse decades of regulatory malpractice. He highlights initiatives to eliminate artificial dyes, restrict sugary and unhealthy foods from federal assistance programs like SNAP, and dramatically improve military meal quality through partnerships with chefs who provide fresh, affordable options that have enhanced soldier health and preference. Programs such as SNAP have now been tailored to disallow candy and soda purchases, with 20 states adopting waivers, mostly red states, while blue states resist, reflecting ongoing partisan divides over nutrition and poverty policies. Kennedy also emphasizes the importance of cooking education to overcome cultural and skill barriers to healthy eating. Kennedy stresses the dire rise in childhood obesity, diabetes, and autism rates, labeling the current environment as one of mass poisoning. He criticizes the complex web of economic incentives which profit from disease rather than wellness, implicating pharmaceutical companies, insurers, and hospitals. The fee-for-service medical model financially rewards additional treatments and interventions rather than health outcomes, creating resistance to preventive care. He advocates restructuring payments to providers with capitated fees that incentivize keeping patients healthy. The mental health benefits of nutrition are also mentioned, with studies showing significant symptom reduction in schizophrenia and bipolar disorder through dietary changes. Similarly, improved nutrition in prison settings lowers violence and restraint usage dramatically, framing nutrition as a public safety imperative. One of the groundbreaking reforms Kennedy details is the push for price transparency in healthcare, mandated by law but previously unenforced. Consumers will soon access clear pricing for services like childbirth across local hospitals, revealing price disparities ranging from $1,300 to $22,000 for identical care. This transparency fosters consumer choice and competition, analogous to menu pricing in restaurants or car dealerships. Coupled with this, medical records access barriers are being dismantled, with tech companies agreeing to end information blocking, enabling patients to carry full health records on smartphones and share data seamlessly with providers. Apps like Yuka, which evaluate grocery products for healthiness with easy-to-understand labeling, proliferate, encouraging healthier food choices. These advancements collectively empower individuals to manage their own health more actively. Kennedy explains historic and successful efforts to lower prescription drug prices in the U.S., which previously paid 2 to 5 times more than European countries. The most favored nation rule, enabled by vigorous negotiation and President Trump's involvement, ties U.S. drug prices to the lowest prices in other developed nations. This led to unprecedented agreements with pharmaceutical companies to lower costs and reshore manufacturing plants, easing supply chain vulnerabilities. This reform benefits all consumers, offering lower copays and direct purchase options via programs like Trump Rx, significantly reducing costs for expensive medications like IVF drugs. Kennedy underscores the importance of preserving American innovation while making drugs more affordable. The discussion touches on the regulatory challenges surrounding peptides, a class of therapeutic compounds with growing demand for various health applications. During the Biden administration, many peptides were shifted into a restricted category by the FDA without safety signals, halting compounding pharmacies from legally producing them. This caused a surge in black market distribution with questionable quality. Kennedy expresses hope that regulatory adjustments will soon restore safe, legal access to these treatments, balancing innovation with consumer protection. Kennedy, Rogan, and the guests discuss emerging acceptance of psychedelics such as MDMA and psilocybin for treating PTSD, depression, and addictions. He highlights ongoing clinical studies, especially in veterans, and administrative efforts to establish strict therapeutic guidelines and controlled access frameworks. Recognizing the dangers of unregulated or inappropriate use, Kennedy stresses the necessity of careful clinical protocols and follow-up. The conversation reveals growing bipartisan support for integrating these treatments into mainstream healthcare, propelled by testimonials from veterans and public health advocates. Successful treatment of opioid addiction with ibogaine is noted as particularly promising, with high remission rates reported. The dialogue shifts to concerns about digital censorship, social media algorithms, and the crisis surrounding free speech in Western democracies. Kennedy notes massive arrests in the UK for social media posts on sensitive topics and new legislation that potentially holds liable for patrons' speech, risking chilling effects on public discourse. He criticizes these developments as authoritarian and cautions politicians about the long-term consequences of silencing dissent, highlighting the importance of preserving platforms of debate for democracy. Both guests lament the decline of civil discussions in mainstream media compared to the podcast format, praising long-form conversations' ability to break down tribalism and foster mutual understanding beyond divisive soundbites and shouting matches. Kennedy praises state-level initiatives restricting student cell phone use during school hours, citing improvements in student focus, disciplinary reductions, and academic gains. He shares anecdotal evidence from schools that initially resisted the bans but eventually welcomed them for improving social interactions and family engagement. Again, partisan resistance is observed primarily in blue states, which Kennedy attributes to ideological rather than practical concerns. Kennedy offers a detailed perspective on U.S. immigration enforcement, tracing shifts in party alignments and public attitudes. He reflects on his experience working with Cesar Chavez, noting early Democratic opposition to immigration contrasted with Republican support driven by corporate interests. The situation today is reversed in many ways, with immigration enforcement politicized and sanctuary cities complicating cooperation with federal agencies. He emphasizes the scale and chaos of recent border crossings, coordinated by cartel networks exploiting porous enforcement policies, resulting in overwhelming influxes exceeding 10 million people. Kennedy highlights that a large majority of those arrested have criminal records or gang affiliations, and criticizes protests obstructing law enforcement as dangerous and poorly understood. Kennedy condemns the partisan framing that excuses illegal immigration based on political allegiance, expressing concern over policy breakdowns that prioritize ideology over public safety and rule of law. He also discusses legislative complexities surrounding state liability for harboring undocumented immigrants. A significant part of the conversation tackles glyphosate and modern agricultural practices. Kennedy acknowledges glyphosate's entrenched role in U.S. farming, with 97 to 98% of corn and soy produced using it, and the national security risks posed by dependence on Chinese supply chains. While recognizing glyphosate's harms, such as disrupting soil microbiomes, contributing to health issues like non-alcoholic fatty liver disease, and possibly gluten-related disorders, he stresses the necessity of a carefully managed transition. Kennedy highlights innovative technologies, including laser-based weed control, that can drastically reduce herbicide use while boosting crop yields and shortening growing seasons. These technologies, though expensive up front, offer economic benefits and potential for rapid adoption alongside regenerative farming practices. He underscores the difficulty of replacing petroleum-based fertilizers and scaling organic farming practices to meet national production needs, but expresses hope that robotics and precision agriculture may provide long-term solutions. The conversation touches briefly on pesticide litigation, Monsanto-Bayer settlements, and government efforts to fund sustainable agriculture initiatives. Kennedy outlines forthcoming federal definitions of ultra-processed foods and mandatory front-of-package labeling systems designed to inform consumers quickly of product healthfulness through color-coded signals. This transparency aims to shift both consumer behavior and corporate sourcing, encouraging healthier food environments. He acknowledges the challenges in changing deeply ingrained dietary habits, but notes that most Americans desire better health and respond positively when provided with clear, accessible choices. To improve patient experience, Kennedy announces agreements eliminating most insurance prior authorizations, reducing treatment delays and administrative burdens. Patients will know immediately if their insurance covers procedures like surgeries upon doctor consultation. Combined with medical record access reforms, these initiatives aim to create a seamless, transparent healthcare journey, increasing efficiency and saving lives by reducing critical medical information delays. Throughout the episode, Kennedy praises Joe Rogan's podcasting model as a cultural phenomenon that revives meaningful dialogue across ideological lines. He contrasts it with social media's divisiveness and mainstream media's confrontational formats, underscoring the importance of such spaces for rebuilding public conversation and mutual respect. Kennedy reflects on his working relationship with President Trump, praising the unwavering support and empowerment he received, enabling him to make unprecedented progress across various reform agendas. He credits team cohesion and shared mission focus for their accomplishments, which he rates as historic in pace and scope compared to previous administrations. Kennedy shares personal reflections on managing ADHD, family life with 7 children, and the rigorous demands of his role, which he treats as a full-time, around-the-clock commitment shaped by a president with seemingly boundless energy. This summary encapsulates the wide-ranging, detailed conversation as Robert F. Kennedy Jr. discusses public health, policy reforms, and the socio-political landscape shaping America today.